Good afternoon, everyone. I'm very happy to welcome you to our Healthy Living Together program today. And this will be available also on our YouTube. We do these monthly on the third Wednesday of the month. And you can mark your calendar ahead for September 15th, when Kellie Phelps from Sanilac County Community Mental Health will talk to us about suicide prevention for friends and family. We have a few housekeeping rules today, which I would like to review with you. Your audio is automatically muted. If you would like to ask a question and answer function, please use the Q&A box at the bottom of your screen, and we'll be sure to do our best to answer your questions. And then Nina Barnett, Public Relations from McKenzie, will send you an email so you can see this later on in a follow-up email. I'm Louise Flashes. I am Director of Human Services here at McKenzie Hospital. I'm also pleased, because it relates to today's program, to let everybody know I became a grandmother this month of August. And I had to run out and get a TDP shot, tetanus, diphtheria, pertussis. And our guest speaker today, Katie O'Mara, Nursing Director for the Sanilac County Health Department, will talk to us about all immunizations that children and adults should keep in mind. And I'm very, very pleased to turn our program over to Katie today and appreciate her sharing her expertise with us.
Hello, everyone. I'm Katie. I have been at the health department for 5 years now, working in public health. Today, I'm going to present to you immunizations across the lifespan. We will talk about all of the vaccine preventable diseases, as well as when vaccines are recommended for all ages and how you can access those vaccines. So I'm going to go ahead and pull up my PowerPoint. Okay. So the whole goal of vaccination is to accomplish immunity. Immunity is the presence of antibodies in a person's system. These antibodies are designed to fight off disease-carrying organisms and prevent individual from getting that specific disease. There's two types of immunity that we're going to talk about. The first one is active immunity. This is where a person's own immune system kicks in. They've been exposed to the disease, and their body makes antibodies that are then able to fight off that specific disease when you come in contact with it in the future. There's natural immunity, which happens when you're exposed to the actual disease. And then there's also the vaccine-induced immunity, which is introduction of a killed or weakened form of the disease through a vaccine. Active immunity is long-lasting, a lot of times lifelong, and it's created by a person's own immune system. Passive immunity is the second type, and this is where antibodies are passed or are provided to a person instead of their immune system creating them. This can happen through mothers passing it through their placenta while they're pregnant, and then also through their breast milk after the birth of the baby. There's also a way to do passive immunity through what we call immune globulin. This is a blood product that carries antibodies, and this is given to individuals that are in need of protection following a specific exposure that they may have. So this is just a list of all of the preventable diseases. We'll talk about each one of these individually, and these all have vaccines available, which is why they are considered preventable diseases. The first one is Hep A, Hepatitis A. This is a serious liver disease. It is spread what we call the fecal oral route, which is, so in basic explanation, someone goes to the bathroom, they don't wash their hands, and then they prepare your food. Then you eat the food. You have now been exposed to hepatitis A and don't even realize it. This one's quite common and can be very serious. Some of the symptoms include fever, stomach pain, loss of appetite, tiredness, vomiting, jaundice. Jaundice is yellowing of your skin or your eyes, dark urine, or a lot of times, especially with children, there are no symptoms at all. So people can be spreading hepatitis A without even knowing it. Hepatitis A, there is a 2-dose series to be completely vaccinated for this one. Hepatitis B is also a serious liver disease. It is spread through contact with blood or bodily fluids. This one, the symptoms include fever, tiredness, loss of appetite, nausea, vomiting, diarrhea, and pain in the muscles, joints, and stomach. Again, children often show no symptoms with this disease, so can spread it without even knowing. With hepatitis B, you can develop serious or cause liver damage or even liver cancer. This one is a 3-dose series with vaccination. Rotavirus is another one that is spread by the fecal oral route. The symptoms include diarrhea, fever, vomiting, stomach pain. One of the biggest concerns with the rotavirus is it can cause severe dehydration, which often for babies is why they end up being hospitalized with rotavirus. Rotavirus can also last several days on a surface, so it's very easy to spread. This one is a 2 to 3 dose series, depending on the type of vaccine that you receive. This one is an oral vaccine as well. HIV. So this one is spread by droplets or direct contact. Children under 5 are at most risk for this, for severe disease. Some of the symptoms include high fever, confusion, headache, stiff neck, light sensitivity, poor eating or drinking, low alertness, vomiting, throat swelling, joint, skin, or bone infections, as well as pneumonia. The biggest complications from this could be death, brain damage, and deafness. The symptoms with HIV differ depending on which part of the body it affects. The most common type is called HIV meningitis. This one's very serious. 1 out of 20 people who contract this will die. And then if out of those that have contracted it, 1 out of 5 who survive are likely to have either brain damage or become permanently deaf. This one is a 3 to 4 dose series. Pneumococcal. This one is spread through coughs and sneezes. It can cause lung, ear, blood, brain, and spinal cord infections. This one is, again, the symptoms depend on the part of the body that it affects. The most common symptoms include fever, difficulty breathing, ear pain, stiff neck, headache, confusion, and sleepiness. So the pneumococcal pneumonia is affects the lungs. The pneumococcal meningitis affects the lining of the brain and spinal cord. Those are the two most serious forms. Some of the disease complications that happen with severe disease is deafness, brain damage, loss of arms or legs, and even death. This one is a 4-dose series in childhood. And then there's also, there's booster doses recommended for adults. Polio. This one's spread by coughs or sneezes, and then also the fecal oral route again. The disease symptoms, a lot of times people don't have any symptoms, but if they do, it could be sore throat, fever, nausea, headache, weakness, and paralysis. The biggest complications with this one is paralysis or death. This is a 4-dose series. The United States has been polio free for 30 years, and that's thanks to vaccine. It is very prevalent still in other parts of the world. So the concern is that, you know, people that are traveling that are not fully vaccinated could bring it back to the United States, and it doesn't take much for an outbreak to happen. So diphtheria. This one's also spread by coughs and sneezes. The symptoms include sore throat, mild fever, weakness, swollen glands in the neck. The complications related with this one are swelling of the heart muscle, heart failure, coma, paralysis, or death. 1 out of 10 people who get diphtheria will die. This one is a 5-dose series as a child, and that's called DTap. And I'll get into the next 3. This one, including the next 2 diseases that I talk about, are all part of the DTap and the Tdap series. So there's 5 doses of DTap as a child, and then as a teen, they recommend a booster dose, and that's the Tdap. And I'll go into the next ones with that as well. The next one is the tetanus. So this is also known as lockjaw. Bacteria found in the environment are spread by exposures through cuts in the skin. So it's found in soil, dust, and manure, and it can enter your skin through cuts, burns, or even animal bites. Disease complications, symptoms: painful muscle stiffness, muscle spasms, difficulty swallowing, fever, seizures, and blood pressure changes. The biggest complications with this is the muscle spasms can cause broken bones. Because of the jaw stiffness, it can cause difficulty breathing, paralysis, and death. So again, this is one with the 5 doses of the DTap and the 1 booster dose of Tdap as a teen. Pertussis, which is also known as whooping cough, spread by coughs and sneezes. This one's mild to severe cough, runny nose, apnea, difficulty breathing, eating, or sleeping. With the symptoms, this is very well known for the cough. Very, very consistent coughing and very hard. That's what's causing the difficulty breathing and trouble eating or sleeping. And sometimes babies more likely will stop breathing, which is what that apnea means. They'll stop breathing temporarily. Disease complications include hospitalization, pneumonia, seizures, brain damage, and death. It's, again, most dangerous with babies and young children. This is the one that it's the Tdap. It's the 5 doses of DTap and then a booster dose of the Tdap. But they also recommend getting a dose of the Tdap with every pregnancy. So if you, like Louise talked about earlier, if there's a new baby coming in, if you've never had a dose of the Tdap, we highly recommend getting that dose 2 weeks before you would be around the baby. but also the mother should get it with every pregnancy, because this is that passive immunity where they can pass the antibodies onto the baby until the baby is able to get the first dose of DTap themselves at 2 months. Varicella. So this is chickenpox, very well known, spread by air or touch. The symptoms include an itchy rash, tiredness, headache, fever. It's usually mild in children, but some cases can cause severe problems. The trouble with this is you don't really know who will end up with the severe, serious disease. The complications included are skin infections, dehydration, pneumonia, encephalitis, which is brain swelling. This is a 2-dose series. Measles, it's spread by air, coughs, and sneezes. Symptoms include rash, cough, runny nose, red eyes, diarrhea, and ear infection. Complications are brain damage, deafness, pneumonia, or death. Measles is very contagious. There are still cases in the United States every year. When I say it's very contagious, here's an example. So you could be in the same room that someone who had measles was in 2 hours ago. They're now gone, but they were there 2 hours ago. You could still contract measles in that scenario. This is also a 2-dose series. Mumps is spread by air, coughs, sneezes, close contact, and saliva. The disease symptoms include swollen salivary glands, fever, headache, tiredness, and muscle pain. As you can see in like the pictures, it's mostly known for the swollen glands. Disease complications include meningitis, encephalitis, pancreatitis, and then also inflammation of the testicles, ovaries, or breasts, also deafness. This is a 2-dose series as well. Rubella is spread by cough, sneezes, or direct contact. Disease symptoms include rash, fever, swollen glands, cough, runny nose, eye redness or swelling, and then often no symptoms. So usually mild. Children might not show many symptoms. Where it's very serious is in pregnancy. So if a pregnant woman were to contract rubella, they could have miscarriage, stillbirth, premature delivery, birth defects such as deafness, blindness, heart defects, or liver or spleen damage. So that's why it's very important for people to be up to date in that one. And this is a 2-dose series. Meningococcal, this is spread through saliva and close contact. The symptoms include fever, headache, severe aches and pains, nausea, vomiting, rash, and confusion. The complications are loss of limbs, deafness, nervous system problems, brain damage, and death. The big thing with the meningococcal and why it's so scary is it can have a very quick onset. Someone could be completely healthy, and within 48 hours or less, they can, if they have meningococcal, they could get very seriously ill, needing hospitalization. So it's very quick, and if you don't respond quickly, obviously the disease complications can be very bad. This one is a 2-dose series. Human papillomavirus. This is known as HPV. It's spread by intimate skin-to-skin contact. Symptoms include genital warts. And the biggest complication with this is it can cause multiple types of cancer and even death. This is a 2 to 3 dose series. It depends on when you initiate the vaccine, whether you would need the 2 or the 3 doses. Varicella Zoster. So this is also known as, I wrote it in there wrong, but shingles. So the disease symptoms include pain, burning, numbness or tingling, sensitivity to touch. There's a red rash, blisters, itching, fever, headache, sensitivity to light, and fatigue. Some of the major disease complications include vision loss and neurological problems, and also skin infections. This is a 2-dose series as an adult. So I went through all of the preventable diseases. Now I'm going to go through the schedules, the recommended schedules. So this first one just covers birth to 6 years of age. And I apologize because they can be sort of confusing and a lot to look at, but I'm going to try to explain it the best that I can. So at birth, the first vaccine that any child will receive is hepatitis B. This is recommended to be given within 12 hours of birth, and it's to protect the baby from, anything that, well, it could have been spread from mother unknowingly, or any invasive procedures or anything like that. There's a chance for spread of that as well. So after that first dose of Hep B, the rest of them will pretty much align with well child visits. So a lot of people can get these at their primary care providers. So the next group of shots would be at 2 months of age. Baby would be due for their second dose of Hep B, the rotavirus, the DTap, which is the diphtheria, tetanus, and pertussis, all in one vaccine there. The Hib, the pneumococcal, and the polio. Now, at 4 months of age, minus the Hep B, those same vaccines are going to be recommended again. So the rotavirus, the DTap, the Hib, the pneumococcal, and the polio. Then at 6 months of age, they would need that last Hep B, and that would complete that series for that one. The rotavirus again, DTap again, Hib again, and the pneumococcal and the polio again. In addition to those, at 6 months of age, children are now eligible to receive their first flu shot. And then at that point, it's recommended yearly. Then the next age range where they would need any vaccines would be 12 months of age. And that would be the Hib again, the pneumococcal again. If they didn't receive the Hep B or the polio previously, they could complete that series there. And then they'll be introduced to 3 new vaccines at the age of 12 months, which is the MMR, measles, mumps, rubella, and the varicella, which is the chickenpox. Also the Hep A, that would be when they'd receive their first dose of that. The second dose of the Hep A, I believe, as long as it's 6 months later, they can get the second dose and finish that series as well. And then between 15 and 18 months, they would need another dose of the DTap as well. A lot of times it's at that appointment they would do that second dose of Hep A as well. So I went through, then at 4 to 6 years of age. So at 4 years old, they're now going to be eligible. They'd get another DTap, another polio, and then they'd get their final dose of the MMR and the varicella. Sometimes those can be given, some of them can be given as a combination vaccine. So you can talk to your provider about that, the availability of those, and that can save children from getting extra pokes. Put all the not all of them, but some of the vaccines can be included in one. Now, what I just discussed is the recommended schedule from the CDC. Granted, there can be some deviations to the schedule, and depending on how parents decide to do it, it may differ on when you'd be due for what. But what I just discussed was the ideal schedule, starting from birth to 6 years of age. Now, this one's a little harder to read again, but this is recommendations for children or teens 7 to 18 years. So if they had been up to date on all their childhood vaccinations, the biggest ones of concern for any children 7 to 18 years would be the booster dose of the DTap, which would be earliest would be age 11. And then the HPV, which is a 2-dose series, if you start it at 11 years of age. If you start it, I believe, after 16, they recommend the 3 doses. The meningococcal. Now, as you can see here, there's 2 different types. The main one that we talked about earlier is called the ACWY, and that's a 2-dose series. And then there's also the meningococcal B, which just covers that certain strain. That one isn't initiated until 16 to 18 years of age. And that one's more so recommended for kids who are going to be living in dorms and close quarters there. Again, flu vaccine is recommended yearly. And if any of the other vaccines hadn't been initiated yet, those could always be caught up, as a teen as well. Okay, so now this is the adult schedule. And basically, same thing goes. We're assuming that they had received all of their recommended childhood vaccines, their yearly flu shot, and Tdap with every pregnancy. The other thing with the Tdap to consider is after they get that Tdap as a teen, the tetanus portion is recommended for a booster every 10 years. So they have the tetanus, you could do the Tdap again, or they have plain tetanus with just the tetanus component in it. Other than that, at 50 years of age is when the shingles shot is recommended, and that's a 2-dose series. Like I said, you can start it at age 50. And then also I talked about for the pneumococcal, there's booster doses, and those are normally for healthy individuals only recommended starting at the age of 65. And it depends on, their health history and that sort of thing. Providers might recommend that a little sooner, but healthy individuals only starting at the age of 65. So I went through all of the schedules, and that's, again, the ideal scenario, but there's always deviations to that. Another thing I want to discuss is access to vaccines. So any private providers usually have vaccines at their offices, but we also have at the health department here, we provide vaccines. We have what's called the VFC program. And this program is federally funded, and it provides vaccines at no cost for kids that might need it. In order to be eligible for this, the vaccine would be no cost to the patient, but they'd have to be uninsured, underinsured, have Medicaid, or are American Indian or Alaska Native, and under the age of 19. So that's what would qualify for this program. There's also a similar program for adults. It's called the MIAVP, and it's, again, federally funded. And for any individuals who are uninsured or underinsured as adults, would be able to qualify for this and get vaccines at no cost to them as well. There's also, including the health department, there's 9 other VFC providers in Sanilac County. So if you're concerned about being able to pay for the vaccines, there's plenty of options to help with that. Okay, so I'm also going to touch briefly on COVID vaccine. Here at the health department, we offer clinics weekly. They're not actually at the health department. We are offering them currently at the community mental health building, which the address is listed there, as well as a phone number if you have need assistance getting an appointment scheduled. We also have a link to register online on our website and our Facebook page. The vaccines at each clinic, we will offer Moderna, Pfizer, or J&J. The Moderna is for individuals who are 18 years of age and older. This one is a 2-dose series, and it needs to be 28 days apart. The Pfizer is anybody who is 12 years and older would qualify for that one. This is a 2-dose series as well, but it is a 21-day interval in between doses. Now, granted, the ideal would be the 28 and the 21 day, but if you are a little bit past that, it's still okay to get the vaccine and it's still effective. The J&J is for 18 years and older, and that is a 1-dose series. Like I said, we offer each one of these at each of our clinics. So you would just have to specify which vaccine you would be interested in. There's also several pharmacies that are offering the COVID vaccine as well. I will touch quickly, booster doses are coming down the line. They've been approved for immunocompromised, and it sounds like they are going to approve anybody that's 8 months out from their last dose would also be eligible for a booster dose. We are currently not doing booster doses. We are just waiting for our standing orders to be in place, and then we will start initiating those as soon as we can. So watch our Facebook page and website for more information on that. And then this last slide is just how you can contact us, our address, phone number, and at www.sanilachealth.com is our website. And that concludes my presentation.
Katie, that was so informative. Thank you. One question did pop up. I think you've answered it, but let's bring it out since it was asked. And that is, should an adult, someone over 18, get a tetanus shot every 10 years?
Yes. Yeah. It is recommended to get that booster every 10 years. For the tetanus component. You can get the Tdap, which covers the diphtheria and the pertussis as well, but it's mostly the tetanus that they're worried about the booster for. They recommend it for every 10 years, but we also would recommend, like, if you have a bad cut or get bit by an animal, we would recommend we can give that booster as early as 5 years. So we would recommend that booster in those scenarios. But if you go without any injuries or cuts or anything, 10 years is sufficient.
Katie, you just made me think of a question because you said bit by an animal. Mm-hmm. So what happens here in Sanilac County if someone does get bit by an animal and there's a concern for rabies?
So actually that's a whole another area that the health department deals with. So if a person gets bit by an animal, it kind of depends on the scenario, but we will assess whether or not rabies vaccine is needed. There is rabies vaccine available, and I believe it is 4 doses to complete the series after an exposure. We would recommend that if certain criteria aren't met, so like let's say you can observe let's say it's a dog and you're able to observe the animal, it's up to date on its vaccines, and the dog is healthy after a 10-day quarantine period, you can safely assume that that dog did not have rabies at the time that you got bit. And we wouldn't, in that scenario, we wouldn't recommend rabies vaccine. Now, let's say someone got bit by a dog. It was a stray dog, came out of nowhere, just started attacking them, looked sick. They weren't able to observe that dog. It ran away and no one's found it since. Wasn't able to be sent in for testing. We would then recommend the rabies vaccine. If someone were to contract rabies, once they start having symptoms, it is too late and it's deadly. If you can initiate the rabies vaccine before the symptoms would start, that's where the protection comes in. So that's why that's such a touchy subject. But
thank you. And another question came in. It was specific to the tetanus. How do I know when my last shot was? But just in general, I guess the question could be, how do I know what shots I've had and what might I need?
That's a very good question. So we, in Michigan, it's called the MICR system. So any providers that are giving vaccines, it is required for them to report those to the MICR system if it's somebody under the age of 19. So currently, if any children have received any vaccines, those should all be up to date and in the MICR system. And any providers, us at the health department, we all can access that, and we could get you a copy and discuss the need for vaccination. So you can either talk to your provider, come stop in at the health department, give us a call, and we can discuss what vaccines show that you're due for. Anybody that has not been entered into the MICR system, which would be more so adults that, you know, they didn't have this available during that time. If you had those records still, you could bring them in and we can enter them into the MICR and also assess at that time what you would be due for.
Thank you very much. And please remember, Nina Barnett from Public Relations will send us an email link to this YouTube. And please join us again September 15th when Kellie Phelps from Community Mental Health will talk about suicide prevention for friends and family. Thank you, one and all. Let's stay healthy together.